Bismillahirrahmanirrahim. Assalamu alaikum, doctors. This is Dr. Saeed Ali from Med Xpert. I hope all of you are doing well. Today, I want to discuss something very important regarding NRE NUMS licensing exam. Many fresh graduates ask me, Sir, where should we start? Which subject we should focus on? The answer is very simple, students. According to the NRE NUMS blueprint, basic sciences carry about 30% of your exam, while the clinical subjects, it carry about the 70% of your exam. That means around 140 out of 200 MCQs, it comes from your clinical subjects. So does that mean you should ignore the basic sciences? So the answer is absolutely not. You have to study both. If you want to prepare strategically, your first priority should be completing the major clinical subjects because they carry the highest weightage. Once your clinical foundation is strong, you can easily cover the remaining basic sciences. So here we go. You can see in Med Xpert like the daily topics. So we are mainly focusing on the clinical subject like the clinical sciences in the first go, and with that we have one topic from one basic sciences as well, because we want to cover the basics sciences at the basic subjects along with the clinical one, so that by the end of preparation you do not miss any important area of the exam. Let me show you. Now here we go. You can see here, these are the clinical subjects. We have surgery, medicine, peds. Now, if we see on the alternative day, we can see gynecology, neurology, and biochemistry. So you can see we have 5 clinical subjects and we have 1 basic science. We are going in a way so that we can cover everything, because we know that 70% of the exam is comprised of like your clinical knowledge, your clinical subjects, and only 30%, like the 60 MCQs, it's from the basic sciences. So first we have to focus on the major area of this exam. Now here you can see we have a mock exam. Every week any topics that you clear, so at the end of the week we have a mock exam, so that all those topics you have been gone through, so that you can do practice. And also we have like a daily practice MCQs as well. Now you can see here we have covered this a lot of stuff. So now see here, we have surgery, we have medicine, we have peds, and we have endocrinology. Now if we come to now here you can see gynecology, neurology, biochemistry, and rheumatology. So this is the basic plan for the NRE NUMS students. It's really important. Now let me share something as as your mentor. So one of the biggest mistake is I see is that students keep watching lectures after lectures without actually studying. Licensing exam are different from your university exam. For NRE, NUMS, PLAB, and USIMILI, those kind of licensing exams, you don't need lectures alone. Like if you will just go for the lectures, it will be just waste of your time. So you should need 3 things. The first one, you should have a reliable notes. The second things, you have a you need daily MCQs practice, and the third one, you need regular revision. So these 3 things are the real key to success. Another question students ask is, sir, should I study from 10 different books? So the answer is no. Choose reliable resources and stick to them. International resources like First Aid, Step 1, USMLE are like the CK2, and other standard references are excellent, but many fresh graduates struggle because the concepts are presented at a higher level. That's exactly why we created Med Xpert. So Med Xpert is really simple because every topic is designed around what the examiner actually tests. Instead of unnecessary details, we focus on clinical features, diagnosis, differential diagnosis, investigation of choice, gold standard investigation, initial management, definitive management, complications, risk factors, high yield exam pearls, rapid revision at the end of every topic. So now here you can see, here we have a clinical scenario, clinical features, right? There's a diagnosis, the definition, one killer line, like from where these are the high yield concept, like heavy menstrual period, like bleeding, enlarged irregular uterus. So you should think about the fibroids, right? So this kind of stuff you can see here, like we have basic concept. We have a very high yield facts here, like most common benign tumor of the uterus, estrogen dependent tumor, common during reproductive age, shrink after menopause. So those kind of stuff we are providing here. So this structure helps you revise an entire topic in just a few minutes before your exams. And as for every NRE one session, we have 3 to 4 months, and it's enough to go through these things. But if you will go with lectures and those kind of stuff, it will be, I think, waste of your time, because the thing is, you are already a graduate. You got lectures at school, at medical school, and now it's your turn to study yourself, but you need some good resources, right? So now you can see here, we have types, hallmark presentation, clinical features, complications, investigation. You can see initial investigation, investigation of choice, management. You can see like medical management, surgical management. Now you have a Med Xpert examples. You can see common exam traps. So this kind of stuff, it really helps you when you are preparing for licensing exams. Remember this. Success in the NRE is not about studying everything. It's about studying the right things repeatedly. Because you can go to the PMDC website, they have very precise schedule. They have the syllabus where they provided each and every topic, every clinical subject they have mentioned. So you don't have to go for everything. You need to have like a reliable resources and a good direction. Okay, now here, like if I will tell you most candidate why they fail, most candidates fail not because they are less intelligent or competent, but because they don't have the proper plan. They study random topics, use too many resources, going for unnecessary lectures, and wasting their time. If you have 3 to 4 months before your attempt, this is enough time to clear this exam, provided you like, if you will stay disciplined. It depends on you. Like in Med Xpert, as I mentioned then, we provide like the daily topics, daily MCQ practice, daily rapid revision points. So I think for you, if I will generally give you a tip, so it will be like you can go like this. You can daily study topics from any reliable resources, practice MCQs every day on the same topics, revise every day with the rapid revision points. Don't keep changing your resources, don't waste your time, don't waste your money. Follow one structured plan and trust the process. I truly believe that with consistency, smart preparation, and the right guidance, every dedicated doctor can clear this licensing exam, inshallah. Thank you, and I will see you in the next lecture. Best of luck, doctors.